Hi, this is Alan Woodley, Premier of the Western Cape, and there have been a lot of questions around the differential in numbers of testing for COVID-19 in the Western Cape versus testing in other provinces. And it's not only just testing, it is tracing, it is also the screening that we do amongst community. But we've got our own Dr. Kariem, and he will give you some more technical backing to what I've just said.
So one of our active case finding strategies is our cluster testing. We're following an epidemiological approach. What our data has in fact shown us is that we've had a number of cases in places like supermarkets where people obviously gather. We've got 46 of these clusters across the province, and what we're doing is in fact actively screening and then appropriately testing all people who are found to screen positive across these clusters. And this is an integral part of the provincial strategy around testing. So our screening and testing strategy, we basically following an epidemiological approach. So obviously we monitor on a daily basis where the cases are, and we follow them up, and we try and determine which communities they've come from, and that helps determine one of our 4 parts of our strategy is the community screening and testing strategy. But obviously we use all our evidence that's available to us to try and determine where the cases are and which communities we should be testing first. So we have 4 different screening strategies that we are employing across the province. The first is our self-screening. Members of the public can go online on the Western Cape Government portal, and they can do the self-screening questionnaire and determine if they need further testing. We've had more than 55,000 people that have used the site already. Our second strategy is probably our most important key focus at the moment. It's the community screening strategy. This is where we have about 3,800 community health workers across the province who have been doing door-to-door campaigning and door-to-door screening. They'll ask a couple of questions based on a case definition, and as a result of that, they'll determine if people need further testing. At the moment, we've already screened more than 170,000 people across the province in many communities. And of the 170,000, we found roughly about 4% have yielded positive results. The third strategy is our facility screening, and with the provincial government as well as local municipal sites, we've probably got 320 facilities where our screening will be taking place, and this is done on a regular basis as the members of the public use the facilities. Our fourth strategy is our cluster screening or workplace screening. We found over the last 2 weeks that we've got outbreaks in several supermarkets across the province. So we'll go there and we'll do a complete screening of everybody, and we'll obviously do testing as required and as appropriate. So our testing strategy is obviously the second part of the screening and testing. At the moment, we've done more than 30,000 tests across the province already. And this is an important part of it. We use different sites for testing, both primary healthcare as well as our hospitals. The tests are then collated and they're sent through to the NHLS where the laboratory is, and we've got 3 of them that are actively involved in testing in the province, and we plan to be rolling out and expanding that capacity over the next couple of weeks. So mobile testing is part of our testing strategy. At the moment, we already have gene expert machines that are in our laboratories across the province. These are fixed gene expert machines, but in addition to that, we've also got mobile gene expert machines. We are expecting them to arrive roughly towards the end of April. These have been ordered and by the National Department of Health, and we will be getting about 28 of these machines to be placed on about 7 mobiles, and we're going to use this to increase our testing strategy across the province.